I'd like to welcome the Executive Director, David Fogel, to say a few words, but before he comes up, so I'm wearing this really flashy neon green band, and it's not a prop. So I came here directly from my rheumatoid specialist. I got diagnosed with Lyme's in 2010, and I told my doctor that I would like a referral to Casey Health Institute. My rheumatoid specialist said, Casey Health Institute does wonderful work. Absolutely. And my referral is right here. So I am the next patient, the next newest patient of Casey Health Institute.
That was not a plan.
What a great introduction.
Anyway, welcome to everybody. Thank you for coming. This was kind of our dream. We didn't think we were going to be able to do this for another year. All the slots are taken, and somebody at the last minute, about a month ago, I think, opened up, and so we said, we want this slot to just host this event. So thank you for coming. I do want to say a few things about Casey Health Institute. I am a local boy. I went to medical school at GW, and have been here most of my life. I'm the CEO and co-founder of the Casey Health Institute. And I do want to, if you can just clear away this whiteboard for a second, this is going to give you a little bit of a background into the key points of what Casey Health does, and also a little bit of a look into what my brain looks like, because this is what I had to explain to our board back in 2011 of what they had gotten themselves into. So, but there's just a couple of highlights. Our main goal, we want to transform healthcare. It certainly means a lot of transformation, and our goal is to do that. That's why we are working really hard and pushing the boundaries of innovation. We are a primary care practice, but we're much more than that. We are collaborative, team-based, with multiple healing disciplines that work in a very collaborative atmosphere with the primary care practitioners. There is not a place that I know of in the country that does quite what we do. I do want to say that this is the core of what we focus on, and that is the patient's experience. And that it's team-based, it's integrated. We have acupuncture, we have psychologists on staff for mental health, we have chiropractors, we have nutritionists, we have massage therapy, we have a naturopathic doctor, and we have a yoga therapist, which is really kind of unheard of. Yoga is a very therapeutic modality that fits in with primary care and many other specialties as a first-line, high-touch, low-tech approach to healing. So we are a nonprofit. We were started with a generous grant from Eugene V. Casey Foundation. And we also emphasize wellness. As you'll see, we have a wellness center, and we'll have tours done by our wellness director, Lori Williams. We also, our clinical area is also, I think, very special, even in its architecture, but it's really set up to be unlike many doctor's offices, which are sterile, where people come in and they kind of get white coat syndrome automatically. It's really set up to be a healing environment, and there's a lot of research about what that is. We have massage and acupuncture demonstrations. Why doesn't everybody who's on staff at Casey just raise their hand? You can talk to them, but if you can take advantage of what an experience is of acupuncture or massage, and that is just a taste of how we try and weave things into a healing experience in a primary care center. We take all insurances pretty much, which is getting more and more unusual these days. You have to pay a concierge fee or a membership fee to get into a lot of primary care practices these days. So there's one other thing. I wanted to talk just briefly about the 4 pillars of wellness. Move more. Lori will say that move more, eat well, stress less, and connect deeply. And that's kind of what we revolve our practice around. And we have lots of support programs for that, as well as everybody's really collaborating with those goals, with the patient really at the center. One other quick thing before I do my last piece is that we are really not just trying to transform the model of healthcare, we're trying to transform the way that healthcare is paid for. And I have a huge chip on my shoulder about fee-for-service because it incentivizes paying people once they get sick and doing as much as you can, and that's how you get paid. I think that's an upside down. We want to pay our practitioners to keep people well, and that is called population health or value-based care. The system's moving in that direction. We're set up from the beginning to capture that, and we're moving on that direction. It's challenging though, so I just want to say we're really trying to push at least 2 areas of transformation in healthcare. The other thing that I'm going to take this opportunity, since I have the business community here, has anybody here heard of a blue zone? Okay, so a blue zone is it's really a community effort to create health. It not only creates physical wellness, but it creates economic wellness for the community. So let's see if I can, okay. I only have, I think, 6 slides, and then you can all go back to eating and drinking. So Blue Zones was originally kind of conceptualized by Dan Buettner, who worked as a fellow for National Geographic for 15 years. And he did this study, and he asked, where do people live the longest, healthiest, happiest lives? What do they have in common? And can that be replicated? And so he found, as he traveled the world for National Geographic, that he identified 1, 2, 3, 4, 5 areas in the world that people live 3 times most likely to live 3 times more than other places in the world, and live to 100. Loma Linda, California, which is the Adventist lifestyle, was one of those areas. I can't pronounce that, but it's in Costa Rica. Sardinia, Ikaria in Greece, and Okinawa in Japan. So, but he put together the factors that the shared traits, and they're kind of like our 4 pillars. Move naturally, you have the right outlook on life, purpose, eat well, and connect deeply. And those are the main factors that seem to help people live longer.
David, you're going to have to go back out because you touched the screen.
Okay. So they've begun creating these blue zones in a number of communities in the United States. And when I started to learn about blue zones, I said, wow, wouldn't it be cool if we could do one in the Gaithersburg area? And so here was the first one in the United States. 2.9 years added to the lifespan within 1 year participating in the project. 49% drop in healthcare claims. 23% drop in smoking. $7.5 million in savings and annual healthcare costs for employers as a result of decline in smokers. And they jumped from the 45th place from 68 out of 87 counties. There's another in the beach cities in California. Obesity drops, exercise increased, diet change, stress dropped, smoking reduction. So there's many benefits for the community, and it has a lot to do with the business community really working together. I know Michelle is an enthusiast of this concept, The Adventist healthcare leadership is very much on board with this. We've had several talks with them, and the former Surgeon General is a big proponent of this, and there he is with us, Casey Health. So he's a proponent of Casey Health's approach and also of blue zones. So since I had everybody here, if you're interested in just talking about this, we're in the formative stages. If you believe in this concept of health, both physical, mind, body, spirit, and also economic health of the area, there's a sign-up sheet, and we're starting to get together a working group. Please let us know, and we'll get you engaged. That's it. I think I did it.